Hello and welcome to Pitt Resource Connection television show. My name is Cindy Asbell with Rural Crisis Intervention right here in Greenville, North Carolina. I had the pleasure today of interviewing with Sascha, who is the physical therapist with ECU Home Health and Hospice. And we're going to talk about fall prevention. It's a very important subject that a lot of us, not only with our relatives knowing what's going on with our friends and loved ones, but just being able to know what's going on in the community as far as how we're helping each other to be safe. Good morning.
Good morning. As Cindy said, I'm Sascha Jilg with ECU Home Health and Hospice. Done this for a little while now, and I've been working with a lot of older folks that do have some frequent falls, and we're going to just give some tips and tricks today, things to think about when it comes to preventing those falls. So first, I wanted to just start by sharing a few statistics because they're a little bit alarming when it comes to falls.
Yeah.
Falls definitely are a threat to older individuals' safety, their independence, and it really generates a huge cost for not only them personally, but also the economy as a whole. So here's some statistics. Falls are a leading cause of fatal and non-fatal injuries for older adults. Every 11 seconds, there's an older adult in an emergency room that's being seen for some sort of fall-related injury. It's even so bad that they say one in every 4 adults that is over 65 years old has a fall each year. And by 2030, they're predicting that we'll have about 7 deadly falls every hour. So falling once will actually increase your chance of falling again. So doing things to prevent these falls in the first place is a really good place to start. And when you think about that cost that I mentioned, older adult falls, they cost about $50 billion in medical costs annually.
Wow.
And 3/4 of that is paid by Medicare and Medicaid.
The time and the money and all that's right. A lot going on there. So clearly we're seeing that falls are a problem.
Yeah.
So what are some of the practical and the tangible ways that an older adult can prevent falls?
So first, I always like to start with kind of my wheelhouse, right? I'm a physical therapist, so we do a lot of things with exercise. Finding a good balance and exercise program is one of the top ways you can help to prevent a fall. You can greatly reduce your risk as a senior from falling by staying physically active, staying strong, staying flexible. You'll find a lot of different programs in local communities which do Tai Chi, do yoga, and those programs can help improve your strength, balance, and flexibility. Seniors are always encouraged to find those exercise programs in their community and even bring a friend that you can help prevent their fall risk as well.
Wow. So when people are apprehensive about exercise, how do you get a safe start with that?
So again, my wheelhouse, you can always request that your doctor kind of do a little falls risk assessment with you, and sometimes they can refer you to a physical therapist if appropriate. I know a lot of patients, they might, because they've already fallen or say they have poor balance, poor mobility, they might be apprehensive about exercising, right, which is understandable. But there's different options out there, whether that's going to an outpatient therapy clinic or if your mobility's, reduced to where it's hard to get out of the home. I work in home health, and home health can definitely help in the home to get you started and then maybe progress to outpatient or these different community programs of Tai Chi and yoga that we talked about. And that kind of brings me to my next step. So that first step, getting an exercise program going. The next step you can take is talking to your healthcare provider. We talked about those statistics of how many people have falls. And there's also another statistic that those individuals that are 65 or older, a lot of them, I think it's less than half. Yeah, less than half of those individuals tell their doctor when they have a fall. So a lot of times it goes unaddressed, right?
Definitely.
Doctors can do a falls risk assessment with you. There's several things that can contribute to falls, right? Everyone, even before that age of 65, should talk to their doctor about their fall risk and share their recent fall history. If it's a home safety issue, they might think a therapist would be warranted to come out to the house and they could get you that referral. If it's a medication issue, medications are a big contributing factor to falls. They can also address that, and that's actually kind of the third step we can take. I know you and I have talked about some things here before we even started today about medications being a big issue, especially as we age. And polypharmacy, which is defined as taking anything more than 5 medications, is one of the leading fall risk contributors as well. A lot of patients will see different specialists, see their primary, and everybody, you know, has their own specialty, and they will add medication. Before you know it, you're taking a lot.
Oh, wow.
And these, I'm by no means telling you to stop your medications, but it's always a welcome thing to go to your primary and then discuss with them, well, what do I really need to be taking, and which medications are going to increase your fall risk, because one of the top side effects for a lot of medications is dizziness, fatigue, and especially if you take a medication that, you know, is to help you sleep or something like that, that can...
You're getting up in the middle of the night or early in the morning, definitely.
Makes you sleepy, will affect your balance. So make sure you review those medications with your doctors.
Even herbs?
So yeah, herbs and vitamins. A lot of people don't think about those. Anytime I go into a house, I have to review not only the prescription medications with my patients, but also their herbs and supplements. And we send a medication review to the primary physician or whoever's following the patient's care, and that physician is then going to look at, you know, that medication list and make sure that there's no issues with it, and that includes herbs and supplements, because those will interact with some of your prescription medications as well. Patients sometimes, you know, will do different things, like they'll borrow medications, they'll miss doses, or they'll double up on and all those things can cause different interactions. More is not always better, and when I come in the home, the patient, you know, they might have had a whole list that their doctor gave them of different medications that they're expected to be taking, but they might have another 3-4 bottles of things that they take at home that the doctor's not aware of, and the patient might not be aware of.
So we need to be aware of everything, because everything can matter. Definitely.
Yes, certainly.
That's definitely a very big risk to not know, you know, maybe even a third of what somebody's got, that, like you talked about, the interactions, the weakness, all the ways that can affect how you can be safe. Because
the doctor may prescribe you a medication, you know, for some new issue going on, and that is not aware of one of the medications you're taking at home, because a different provider has prescribed that to you. Could be, you know, prescribed a while ago, but you're still taking it, and now those 2 medications will interact, cause dizziness, cause drowsiness, or even make one of them, you know, less effective.
Yeah, I know it can be a little bit aggravating to think about how you've got to make sure you know even a list. I know with my parents that they have a list that they keep, I guess their latest visit from the doctor, they print that off, and they make sure that they're keeping up with that, and that's just an easy way. If your doctor can even give you a list of these are the things that you're prescribed, so if you're going to one doctor versus another, they can say, oh, you're taking this, then don't take this, or maybe have this instead. So that communication is a big part of that safety as well, with everybody that you're encountering.
Yeah, it's a very big part of the safety, right? And so a lot of times when I get a home health referral for a patient for physical therapy, the referral will say to, you know, do a home safety evaluation, evaluate and treat. And so that involves that medication review. If you're having difficulty managing your medications and you feel like, you know, you might need some help with that, if that's a way to reduce your fall risk, that definitely is a way to warrant some physical therapy in the home if you qualify for home health services. So we are definitely in contact with the physician as a home health agency, but patients on their own can also, you know, take all their medications, put them in a bag, and bring them in so that the doctor knows what you are taking. And don't dismiss something just because it's over the counter or because it's a herbal supplement or vitamin. Those things can definitely interact and cause some different issues or increase your fall risk.
Yeah, definitely. So in addition to that, we're also vision or hearing changes, those types of things. So what do you recommend as far as with vision and hearing?
Yeah, so vision is a big part of our balance, especially as we age. So that's another, you know, thing that older adults can address. Go see your eye doctor, get an updated set of prescription lenses. Yes, make sure, even just doing something as simple as making sure the glasses are clean so you see well. We don't think about this a lot, but like I said, as we age, we depend more and more upon our vision. for balance. That's because the two other systems that we use for balance, which one is our inner ear, it tends to degrade over time just as its function. And then the other part that we use for balance is actually these little sort of receptors in our joints that will tell our brain what position our joints are moving into, and we make corrective balance reactions based on that information. A lot of times when we get older, we have issues with neuropathies, right? Where the nerves don't function as well. So those joint receptors don't work as well. So you're really using your vision all the time for your balance. So making sure that the glasses are good, and that when you're walking, a lot of times I work with patients on looking upright, looking at your environment while you're walking, so you have the visual reference cues around you to keep your balance. So
you're not head down, you're looking out to what you're going towards.
Right, and so talk about vision, but also hearing, right? If we have hearing impairment, that'll actually make you up to 3 times more likely to fall.
Oh, wow.
And people, I said the inner ear is an issue with balance. That's really a different system than hearing, but hearing's important because we've talked about pets, right? Pets, we love our pets. I love my dog, I love my cats.
Yep.
But they definitely increase our risk for falling, because if they get between our feet or something, trip us up, you're going to go down. And one of the main ways that we know where our pets are around us is to be able to hear them, right? Hear their little feet scurry along the ground. So making sure you have a good set of hearing aids that have a battery that work for you can also really help to reduce your fall risk.
Definitely. So, we've got some really good tips that you have really brought a lot to us, but are there any things that our viewers today that they can do to help reduce the opportunities to fall? Yes,
so definitely you can do several things today to help reduce your risk for falling. 60% of falls happen in the home. They're not always outside on a curb, tripping on a curb. And so keeping your home safe is the biggest way that you can really immediately reduce your fall risk, right? We talk about removing tripping hazards. People love their throw rugs. A lot of them look nice, they feel good under your feet, but especially individuals that use a cane or use a walker, a lot of times those
get caught up in it.
Get caught up in rugs. They'll flip it up without you noticing, and then you trip on it. So I see patients that fall all the time. That's one of my first things I do in homes is say, I see you have that rug there. Can't make you take it up, but I really strongly recommend it, just because that's just removing the potential hazard altogether.
Definitely.
Even if you've got poor balance, even if your vision's not great, not having it there removes an issue. And so again, with that, we talk about your vision. You can increase your lighting at home, right? If you get up at night several times to use the bathroom, a lot of times falls happen in the bathroom. That's actually the number one place in the home that falls happen. And
lots of bath rugs.
Yep. There's a lot of bath rugs, and then sometimes people at night, they don't want to turn on the light, but just turn on that light, because if you already have any vision issues, you want to minimize the strain on your eyes, right? You want to make everything in your environment as visible as possible. I've also seen patients that have like some small steps in their home, and they're not always well marked, right? Just taking, even if it's a bright piece of tape, or you could paint it, just having something to accent it visually so that you see
there's a change there.
Right, rather than missing it or misjudging how far away it is because of any vision issues, and then you trip on it. Stairs, we talk about painting a step. Those are a big place where people will fall a lot of times. If your stairs are rickety, there's resources out there, I think you can speak to that, and where people can get help to have those things looked at so that they're nice and sturdy, and that they have a railing. Not all railings in homes, or not all stairs have railings in homes, and that's going to be one of the best ways to help you safely navigate those stairs, is having a third point of contact where you can steady yourself as you go up and down those stairs. And finally, grab bars. Grab bars are wonderful in bathrooms just to help people steady themselves again with a third point of contact when they step into the bathtub, or when they have to sit down onto a lower toilet, right? Or even better, raise up the toilet so you're not having to go down so low, so that you can
being adaptive to what you need to have to be able to be safe. You talked about the stairs and the grab bars. Our local senior centers, area agencies on aging, a lot of them may have those programs that we could even talk with them, or reach out to them. And I know at one point the Pitt County Council on Aging had a program called Spice, and it had something to do with basically assessing your home and grab bars and making sure things were safe. A lot of the safety assessment pieces to that, the adaptive equipment that you were talking about. and making those things happen. So, you know, perhaps maybe we need to have another conversation and have them brought in as well to kind of enhance some more of that.
I think that would be beneficial, certainly, and that's another part of home health therapy too. If I come into the home, and I think you would benefit from some different adaptive equipment. A lot of times, whether that be a walker, or a wheelchair, or a bedside commode, or a shower chair, I can help you, you know, through getting prescriptions from your doctors to medical supply companies to get some of those things to help you be as safe and independent in the home as possible and keep you that way, because falls a lot of time will be the first incidents that causes people to lose some of that independence, because now they need help to get around. You know, now they've broken a hip or something and they can't bear weight on a leg, and if we can prevent those things in the first place, then even if that means using a walker or using a shower chair, you know, there's no shame in that, because it can help maintain your independence for a long time and just keep you safe, prevent a lot of heartache and pain.
Yeah, definitely. So we've talked about a lot of these formal supports, speaking with you, having you guys coming in, talking with our doctors and all that. Tell us about the importance of having your family members involved.
Family members are sometimes the biggest, you know, advocates for my patients, and really help us get things done, right? It's never a bad idea to talk to your family. And I think a lot of people don't want to feel like a burden, but you know, I mentioned independence, right? Preventing a fall is a good way to help maintain your independence. And if you ask your family to help you, you know, make those little changes in your home, whether that be taking up rugs, working on the stairs, putting up grab bars, they can help you to maintain your independence and to where you won't, you know, necessarily need as much help. So it's always a good thing to go to them now before things are a problem, right? Also, family members can be a great asset in helping provide transportation to doctor's appointments so that we can address the medication issues that we talked about, so that you can share your fall history and the doctor can help determine what a good course of action might be to alleviate any concerns or causes of falls. And also finding the resources, right? If you need transportation to get to some of the agencies that you mentioned that can help, you know, get some grab bars, family can help provide that. And, you know, if your family members are older themselves, you can help talk with them about their own risk and help prevent them from having a fall as well.
And sometimes those reminders from your family, you know, remember you're not supposed to do that, or we need to do it this way to keep you safer.
Right.
You having somebody that can be there to not necessarily nag them, but just kind of give them a little reminder of, hey, remember this is what they recommended, let's try to do it this way, versus not a scolding piece to it, but just a supportive piece to be able to even remind them, remember we need to make sure we get our medications together before we go to the doctor. Remember, you know, physical therapist is coming at 2 o'clock. Let's make sure that we're, you know, we're ready and have everything prepared, that we can have those conversations and do everything to have the best appointment that we can have.
Yes, those are all wonderful ideas, wonderful ways to help get started on fall prevention.
So we've got some really good steps here. We've got a really good, you know, information, ideas, suggestions. So where can our audience go further to get more information on falls prevention?
Right. So first I would recommend going to the website for the National Council on Aging. They have some great resources to help you prevent falls. The website is ncoa.org. If you type in falls in the search bar, it comes up with a bunch of different resources. It can also even help connect you to your state and local falls prevention coalitions. So they have it all lined up, all those fall prevention steps that we talked about, those are all on their website as well. And the North Carolina Falls Prevention Coalition, they now have a new statewide website, which is called standingstrongnc.org. It's also for public use, and it has more tips and resources to help prevent falls. And you can always go to the NC Coalition website itself as well, which is ncfallsprevention.org.
All right. Well, we've got a lot of information today. You've brought a lot to us, a lot to think about, a lot to kind of go, oh, that, you know, that kind of falls into play. That works for us. Just being able to say, hey, this helps us to be safer. This helps our loved one to be able to be safer. This helps with communication. This helps with just the overall being able to prevent being a hospital encounter, prevent having to have additional therapies because you have fallen. Looking at all the things, the medications, you know, the safety, all those pieces to that. So just tell us a little bit more about maybe your final thoughts regarding falls.
So first and foremost, I just want to say that falls are not a normal part of aging. They don't have to be. there's so many things that we can do to prevent them, and in preventing them, maintain independence, age more gracefully, avoid some of those, painful, debilitating, things that come along with a fall that can make aging a less graceful and less pleasant process, right? And so through just practical lifestyle adjustments, some evidence-based falls prevention programs, and the clinical community partnerships between home health agencies, your doctor, the different exercise programs in the community we talked about, the number of falls among seniors can really be drastically reduced, and I'm hoping to see that in the coming years. So hopefully these statistics we shared, especially what did we say, by 2030 they were going to have, how many? 7 deadly falls every hour.
Wow.
Hopefully we can, really reduce that just through some practical, easy things that everybody can do.
Communication, collaboration, asking for help when you need it, and taking advantage of those resources like the therapies that can come in and do safety assessments, medication management, making sure things are not overlapping and interfering with other things, and in general just keeping your house safe.
Keeping your house safe, making sure you're doing your part as far as keeping up with your glasses, having an updated prescription so that you have good vision, as that is the biggest part of our balance now. All practical things you can do and really make a difference.
Stuff. Really good information. Well, Sascha, I'm so glad you came in today to give us this information. It's been a while since we've really had an opportunity to speak more to it. And falls, like you said, this is something that happens every day. This happens to people. It can be prevented. So let's look at what we can do to make that happen.
That's right. Thank you for having me. I've enjoyed speaking with you, and hopefully this makes a difference for everyone.
Thanks so much. I appreciate it. Thank you all for joining us for Pitt Resource Connection television show. You're always welcome to find us on YouTube or the GPAT 23 channel. Otherwise, we hope you have a great day. Take care.